Hi, Dr. McCarthy here, and today we're going to talk about our thyroid treatment success secret number 10. Today we're going to talk about a protein called thyroid-binding globulin, and I'm willing to bet that you guys have not heard of this before. The reason is because you've not had it checked. It's so important in trying to determine what's going wrong with your thyroid, yet it's not properly evaluated on most of our patients. A thyroid-binding globulin is just like a taxi cab. It's a protein that grabs onto your thyroid hormones, T4 or T3, and it carries them around in your bloodstream. Basically, it carries them to the T4 to where it needs to be converted into T3, whether it's in your liver, your GI system, wherever that may be. The problem lies in the fact that we don't know what your thyroid-binding globulin levels are unless you've had them properly checked. If you've got an increase in your thyroid-binding globulin, what that essentially means is that there's too many taxi cabs. And if there's too many taxi cabs carrying the hormones around, the hormones can't jump off and do what they're supposed to do. We need to get both of these checked. So we'll check your thyroid-binding globulin, which has an inverse relationship with your resin T3 uptake. All right, there's a lot of words I know here, but you just have to remember these things. You can't know what's going on in your thyroid unless you have these values checked. And we check them regularly on our patients. You need to get both of them checked. If the thyroid-binding globulin is elevated, we'll see that the T3 uptake is decreased. And the inverse T3 uptake is increased, we'll see that there's a decrease in thyroid-binding globulin. If you haven't had them checked, you're just guessing. And guessing is not a way to get healthy. Remember as well, your T3 uptake, there's very broad lab ranges. The lab says this is normal. I'm telling you that this is normal. This is optimal. So you want to have your values checked and put through our very narrow microscope. Then nextly, some of the things that we need to look at is if you have an increase in estrogen, that elevates your thyroid-binding globulin. So if you elevate your thyroid-binding globulin, it can give you symptoms of hypothyroidism. Well, how can you get increased estrogen? The most common way we see it is females who take the birth control pill. That's estrogen. So you're taking the birth control pill thinking that this is a good thing because the doctor prescribed it for you, but now all of a sudden you've got hypothyroid symptoms. Another way, and often overlooked, and we find this with a number of our patients, is creams, anti-wrinkle, anti-aging creams. These things very often contain hormones like estrogen. So you're rubbing this in thinking how it's going to make you look so pretty, but it's destroying your thyroid gland because it just elevated your thyroid-binding globulin. Conversely, in males, we'll see that an increase in testosterone will elevate your thyroid-binding globulin as well. So if you've got this condition now, the elevated testosterone, we'll see that you wind up with the same hypothyroid symptoms. And then lastly, we want to talk about your liver. Everything, the estrogen, the testosterone, the conversion of T4 into T3 all occurs in your liver. If your liver is not doing a good job of detoxifying, making these chemicals water soluble and flushing them out, then your liver gets clogged up with these things. Excess estrogen, excess testosterone, and that's not a good situation. We have to check all of these things. So I keep saying it in these videos over and over. If you don't know, you're just guessing. If you're okay with guessing, God bless you. If you're tired of guessing and you want to know, you need to call my office now. Don't suffer another minute. Thank you.